My name is Kate Morales. I'm the Deputy Director of Public Health at the Hepatitis B Foundation and Director of Hep B United. We'll be talking today about how community organizations are leveraging the pandemic to conduct hepatitis B programs. Before we jump in though, let's go over a few housekeeping items. I know most of you are probably familiar at this point with Zoom, but just a reminder for audio, you are on mute. Feel free to raise your hand during the Q&A if you'd like to ask a question out loud. Feel free to do that. Chat, drop in a hello to everyone. Feel free to do that and respond to any open-ended questions from the panelists. We're going to be doing a couple of poll questions in a minute. And if you have questions about the presentation content for any of the speakers, please feel free to type those into the question window. And the session is being recorded. We'll share that out afterwards, and we'll also share and post a copy of all the slide presentations. All right, so quick overview about us. We're a national coalition co-led by the Hepatitis B Foundation and APCHO. We're dedicated to reducing the health disparities associated with hepatitis B. Our coalition partners are working to promote hepatitis B awareness, screening, vaccination, and linkage to care in highly impacted communities around the US. We really serve as a forum for information sharing and best practices and strategies around hepatitis B public health programs. If you are interested in joining our coalition, we would love to have you. You can see here where we're currently located in about 23 states. Please feel free to contact us if you don't see your state, and we would love to connect with you. All right, let me go ahead and introduce our great speakers today. First, to start off, sharing from Philadelphia will be Catherine Freeland, who is our very own public health program director, and she also manages the Hep B United Philadelphia program. So she'll be sharing some of their work in Philadelphia. And then we'll have Dr. Amy Trang, who is the administrator of the Hepatitis B Task Force, and she also works with Hepatitis B Initiative Washington, D.C. Dr. Trang will be sharing a little bit more about herself because she wears many different hats. And then we'll wrap up with Danite Yamani, who is the Hepatitis B Program Coordinator with African Services Committee in New York. All right, so I'm going to see first who is in the room with our first poll question. All right, launching the poll now. If you could let us know where you're coming from, that would be great. And I'll just give it another 30 seconds or so. All right, looks like we are nearing a majority of participants. Great, thank you so much. So it looks like we actually have quite a few folks joining us from health departments and community-based organizations and nonprofit organizations. Thanks for sharing. All right, so our next question for you is, we'd like to know if you have incorporated COVID education, preventive services, testing, or vaccination into your hepatitis work. I'll give it another 10 seconds or so. Okay, looks like we have close to 80%. I'm gonna end the poll. Okay, so it looks like majority have not, but a lot of people have as well, nearly 40%. So yeah, I would love to hear what you're doing. Feel free to share in the chat box as we go along. Okay, thanks for participating. All right, well, thank you again. So I'm gonna go ahead and start off with our first presentation now. Turn it over to Catherine to share her screen.
Great. Thank you so much, Kate, and thanks everybody for joining today. I'm going to be talking about some of our outreach initiatives that we've had ongoing in Philadelphia throughout the pandemic, and I want to acknowledge my colleague, Evangeline, who's also on the line, who has been instrumental in helping us with these initiatives at the grassroots level. So this is a bit of an outline of what I'll be talking about today. I'll talk a little bit about Philly and what our burden of hepatitis B looks like. We'll talk about a contactless testing initiative that we started early in the pandemic. And we'll talk about specific partnerships that we've been involved in that have really helped us leverage and reach new populations and establish new relationships during the pandemic. And then we'll share our contact information if you have any additional questions. Oops, excuse me, I went the wrong way. All right, so, excuse me. So hepatitis B in Philadelphia, we have over 200,000 Asian American and Pacific Islanders in the city. We have over 80% of those born abroad, so they're considered to be high risk for hepatitis B virus. Only about 8 to 10% of those individuals considered to be high risk in Philadelphia have been tested for hepatitis B. And this is due to a variety of reasons, a lot of access challenges. And so what we do in Philadelphia within our coalition is try to address some of those challenges. We've had community-based testing activities that we've done since really 2010, and we found about an 8% infection rate from specific high-risk screening in the community. In the Philadelphia area, we've also worked very closely with our health department, and I definitely encourage community-based organizations to really work to establish strong relationships with the health department. They're really able to help us identify areas of need and areas of chronic infection in the city. They're also able to share, unfortunately, that about 60% of people that have actually been diagnosed with hepatitis B in the city are out of care. And that's so our total number of chronic infections is about 25,000 individuals. So during the pandemic, obviously, we had a ton of events scheduled March out through the summer. And unfortunately, as all of our other colleagues on the line probably experienced, everything had to be canceled during the pandemic. And during like the mid stages, when we kind of felt like this was going to be a duration of time for the pandemic, we looked into how can we really work on implementing and addressing the needs of our community still while the pandemic is going on in a safe way. And so we implemented a contactless testing initiative in the community. And I'll walk through the steps of this contactless testing initiative and how we went about doing it. And I'll also talk a little bit about specific partners that really helped us leverage community. So the first process in this is we have an online Google form. Anyone interested in participating in our contactless screening was invited to complete the registration form. It collected contact information, so we were able to mail and register an individual based on their demographic characteristics, and we're able to contact them after testing. We created a voucher and an instruction sheet that was mailed through the Postal Service to individuals that explained what hepatitis B was, the benefits of hepatitis B testing, why they may be at risk, and why it's a good idea. We also mailed them a voucher that they would take to a LabCorp and get tested. We provided the address to the closest LabCorp and their hours of operation and a phone number as well for individuals. We also worked really closely, I just want to emphasize, we worked really closely with our community partners. Many of our communities that we were working with were limited English proficient. And so it was really important to have really strong relationship with our community partners so they were able to answer any questions that may come through in terms of instructions and how to do this logistically. We did mail information in language as well. So that was really critical to the success of this program. So the instructions and the test results were both mailed to participants in their preferred language. So individuals would then take the voucher to LabCorp, get tested, and we would get a copy of their test results. And it was mailed within 7 days, and we offered a $5 incentive for any transportation costs that may have accrued during the trip. Most of the LabCorps in Philadelphia were within a mile, 2.5 miles at most from each of the participants that we were working with. And anybody who was in need of follow-up care was also contacted by our team and linked to care based on their test results. I just want to acknowledge our key partners that really helped make this happen, and kind of steps and strategies that we used that were pretty helpful. We really worked closely with our Asian Pacific American Medical Student Association, both for helping promote this program and also answering questions and helping some with linkage to care as that was needed. They also helped with translating some key messages and filtered that through some of our WeChat platforms that we used with one of our community partners. We used the Northeast Philadelphia Chinese Association as a key partner, and Viet Lead as another organization. Northeast Philadelphia Chinese Association primarily serves the Northeast Chinese community, and Viet Lead serves the greater Philadelphia Metro, Southern New Jersey area Vietnamese communities. And so we wanted to make sure our materials were in those languages respectively. We also hosted a virtual health fair and Zoom education sessions in language that are recorded on our website for really just talking about the importance of hepatitis B testing, why it matters, and who should be tested. And we promoted it through WeChat, like I mentioned before, for the Chinese community. Within local and language newspapers, we used QR codes, which were really helpful to get people to link directly to the registration form and information on the form. We used newsletters and community listservs to help spread the word about the program. So in total, we had about 56 people register to attend or sign up for the free screening. We had 28 people actually complete the screening. We were pretty happy because we realized, we're taking away the convenience of going to a community-based organization to provide services in a neighborhood that is close by. We're asking an individual to take the initiative to go test themselves. And so it's asking a lot of that individual. And so we were really happy with this number because it's just a little bit more, or just around half of the population that was interested. We also continue to do direct outreach and direct messaging to people who completed registration. We send regular reminders saying, hey, if you're still interested, this program is still available, and we will continue probably to do this program beyond the pandemic because it's just another alternative for people to get access to screening. So you can see the breakdown of ethnicity and sex here. You can also see positivity. We had 7 individuals test positive for hepatitis B surface antigen, and we had 17 have surface antibody. This is our referral demographics here. We contacted everyone by mail in their preferred language of their test results. We were able to link those individuals in need of vaccination, 4 of them, to a pharmacy or their primary healthcare provider. We contacted them directly to do so. A few of the individuals that signed up already had a primary care provider, and so we spoke to them about making sure their provider got their test results. And also we worked with a specialist and a local clinic for other referrals as needed. And we use referral based on the individual's needs themselves. I will say one interesting thing that came from this program was we had an individual who was about to undergo chemotherapy for breast cancer. And she went through this test and we were able to find out that she was hepatitis B positive, and she needed to start antiviral treatment prior to chemo so she wouldn't have a hepatitis flare, which was it could have been really instrumental in her care for managing both her hepatitis B and her cancer diagnosis that she had. So that was one really great success of this program that we had. We also have done other activities during the pandemic and tried to pivot. We have hosted and partnered to have COVID-19 vaccination clinics. We use this as an opportunity to engage with new community partners and also potentially establish relationships where we might be able to go out and provide screening once things do open up again. We hosted virtual health fairs, trying to kind of create a platform and list for community partners that might have specific needs met for the community and resources that might be available. We held virtual education sessions, both for our medical students and for our community-based organization and partners. And we also started a provider training ECHO network. So we're working on we completed a full year 2 of training primary care providers so we can really work to expand our referral network for hepatitis B outreach and education. So we've been busy during the pandemic. We certainly have had to pivot, but we've tried to be innovative, and we've certainly gotten inspiration from our community-based coalition partners throughout this on how to figure out how to do these different things. So definitely want to give a shout out to all the Hep B United partners who've done similar activities. And I know a couple of them are going to talk more about their initiatives during the pandemic as well. But just wanted to provide our website and email addresses in case you're interested in learning more about our initiatives. And I think I'll turn it back over to Kate.
Thank you so much, Catherine, for sharing. All right, well, I'm going to go ahead and turn it right back over to Amy Trang to go next.
Hi, everyone. I'm going to share my screen. And hopefully you can see it. So, whoops. I'm Amy Trang, and I wear multiple hats like Kate was saying. Today, I'm going to be focusing on IT solutions and talking about our best practices from HBIDC. And who is Amy Trang? So I'm the founder and CEO of Social Capital Solutions. And this is a SBA certified 8A economically disadvantaged woman-owned small business. And it was started in 2010, primarily to provide pro bono services for nonprofit organizations. And we really didn't look into any cost models until probably after 2013. And I started working with HBIDC in 2013, the National Task Force in 2014, Vietnam Viral Hepatitis Alliance in 2014, and of course joined Hep B United National Advisory Committee, I believe, in 2015. And so all this is under the umbrella of viral hepatitis work. And we started doing COVID-19 projects pretty much in 2020. So I'm giving that context because I know a lot of people on the call have interacted with me in many different capacities and seen lots of different emails and might have been confused of my association, but it's all done under my company, Social Capital Solutions. And what we try to do is we focus on leveraging opportunities, resources, especially among nonprofit as well as public-private entities, so that we could build social impact and serve the communities that are most vulnerable throughout the US. And we do also do some stuff outside of the US as well. So my education background, for those who are unfamiliar, is I have a PhD in public policy. The focus is in organization management and social capital theory. And I also have a master's degree in education, psychological and social foundations of education. And I've been teaching as an adjunct faculty at UVA School of Education and Human Development since 2000, so over 20 years now. Because we're talking about HBI today, I wanted to specifically share with you, if you don't already know, it's a 501c3 nonprofit organization. It started in 2006, primarily to provide outreach education, screening for hepatitis B, and later in 2013 expanded to Hep C services, and 2016 HIV services. And so HBIDC has been very successful in collaborating with a lot of community organizations, faith-based organizations, as well as the local health departments. So they provide culturally and linguistically appropriate viral hepatitis outreach, education, screening, Hep B vaccination, linkage to care, and patient navigation services for their impacted communities. And then also preventative health education for those who may be co-infected with HIV. The vision of the organization is a world free of liver diseases caused by viral hepatitis. And of course, the mission is to mobilize the communities to prevent liver diseases caused by viral hepatitis. So the accomplishments, I won't read it word by word, but you can see that since 2006, we've reached out to over 38,000 individuals, and we've identified quite a number of individuals who were infected by Hep B. And that's an average about 4% every time we do some sort of a screening. In 2020, like many organizations, HBIDC was also impacted by COVID-19. And what we found was limiting for us is we thrive on doing in-person community events. We thrive on having that one-to-one contact and communication with individuals in the community who may be limited in their English proficiency, have very limited income resources, are underserved when it comes to health insurance, or have no insurance at all. And so what we had to do is kind of pivot, not only looking into telehealth and telemedicine opportunities, but also we had to start calling every single patient and asking them, or first providing them information about COVID, asking them about their overall health, and then following up with them in terms of whether or not they have been able to continue their treatment and if they needed assistance with any medication refills. Because we were very concerned of making sure that they were not only safe from COVID, but also healthy because they're dealing with their chronic diseases. So how has HBIDC leveraged the COVID pandemic? Using the same populations that we normally serve, which is the vulnerable, limited English proficient, low or no income, uninsured or underinsured, HBV, HCV, and HIV patients or participants. And of course, their caregivers as well. We did some of the things that Catherine had mentioned in her presentation by what we called a hybrid screening model. It was contactless registration. It included providing vouchers for them to go to a lab for in-person screening, or if we were doing a on-site screening where we were socially distancing ourselves and other participants, we would also give them that option. Most importantly, maintaining and sustaining the multilingual community health workers that we had, fully utilizing their expertise and resources. We disseminated, we continued to disseminate hepatitis B, hepatitis C, and HIV information with the COVID outreach information that we provided. When it was safe to go out again in the summer of 2020, we started distributing PPE care kits and offering not just COVID information, but also the Hep B information. So if you see on this previous screen, this is what our materials look like. And you can see in this area, we also were including the Hep B information with free masks. When we first started doing the care kits, they were cloth masks. Now they're disposable masks and hand sanitizers. And then we started to also look into investing and expanding our capacity through the IT integration tools, because we found that as we were doing COVID outreach, and what happened was we were very fortunate to get funding to do COVID-19 vaccination outreach. And this got us to thinking, how are we going to handle our growing database? And how are we going to separate, record and separate the different disease prevention programs that we have, as well as the different funding opportunities that we were having for these different projects. So we were outgrowing the customized database of the participants that we tracked. We were also looking at how do we effectively track our weekly and monthly activities to efficiently report to our funders, track staff communication, and we're talking about a growing staff of more than 5, and sharing and syncing files that are encrypted as well as HIPAA compliant. And so, the next step we had to do is choose the operating system. Are we going to go Google or Microsoft? And by that, I mean Google Workspace or Microsoft 365. And my personal recommendation for people who are looking into this, as a consultant, I would say, Google Workspace is great if you have less than 5 staff that you're collaborating with, because if you're familiar with having Gmail, all of those tools are very convenient and efficient. If you are growing more than 5 staff members, then I definitely say invest in looking at Microsoft integration, Microsoft 365. And what we did, and I share this because I realized that not a lot of nonprofit organizations know about Microsoft's nonprofit discount program. And it is a process, and not all 501c3s are going to be qualified for this opportunity. So you do have to apply to find out. But the benefit of this is you get up to 10 free user license. And that means you have access to free Words, Microsoft Word, Excel, PowerPoint, Outlook, Teams, and Azure. And what is that? I'll explain a little bit more later. But most importantly, I think that one of the most successful integrations that we have was utilizing Teams for office communication, internal communication, so that our emails don't get lost when we're trying to collaborate on a certain project or trying to communicate about an upcoming event. A lot of times, if you're familiar with trying to manage multiple projects, a lot of emails go flying internally and externally, and there is this high chance that you're going to miss deadlines. So that's what we were trying to minimize, to have that communication more efficient, as well as making sure that we're going to meet our reporting deadlines each month or each week. Or even quarterly. So that's extremely important to keep, to be aware of and keep in mind. And most importantly, if you are doing anything with patient information, you have to make sure that you have HIPAA compliance as well as encryption options. So with the Microsoft integration aside, there's another thing that we had to tackle, and we had to tackle the database. And when we first started collecting data, it was small enough that you can use an Excel spreadsheet, and you could just track the patient information, the call log. But as HBIDC was growing, so from 2013, 2015-ish, we noticed that we were able to reach out to more individuals as we were able to secure more funding. So ZContact is a company that we contract and work with, and they created a customized database for us so that we could track and pull out information for our reports. As we were getting more and more funding from multiple sources, whether it be foundations, government, corporate, we found that we had to look into other alternatives for electronic health record system. So in 2020, HBIDC looked into Dr. Chronos, which is used often in doctor's office. And we wanted to see whether or not that kind of system would be appropriate for us. And we found very quickly that it was not, because a lot of the work that we were doing was more than just clinical records. We were doing a lot of public health stuff too. And so the records that were being kept is slightly different, as well as being able to report for some of our projects that we collaborated with the universities, that we needed to look at a different system. And so it was kind of confusing, because on the one hand, we had Dr. Cronus, on the other hand, we also had to go back to an Excel base. And that to me just didn't make sense. So starting very recently, we started looking at REDCap. And for those who may have already been familiar or is familiar with REDCap, it is kind of like a SPSS or a STATA, one of those statistics databases that you may be familiar with if you are a recent college grad or still working in the university. And what this is going to do for us is it's going to not only track our program participants or patients by customer ID or unique identifiers, it will also allow us to separate grant projects in the different regions that we serve. So HBIDC serves DC, Maryland, and Virginia. And we have, again, like I said, multiple funding sources. And so each project needs could be entered in terms of the data differently. So the data could all be pulled for research and advocacy projects, as well as when we are reporting to our funders. And what this does in real time for staff is it minimizes that slowing effect that you have on your computer when you're opening a really large Excel file. And anybody who has had that experience will know that your system will crash, or your operating systems will just shut down and you just can't work any further. So that's what we were trying to address. So with all changes, it takes a lot of patience. Right now we're in the process of, building this new operating system so that we could expand. We are planting the seeds, and we're just going to move forward and see how much we could expand by just taking a look at the IT systems. So I'll take questions afterwards, but I'll hand it back to Kate.
Thanks so much, Amy. It's really interesting to see how COVID has prompted you to change the infrastructure of your organization. And it was also great to hear that there are some commonalities in how hepatitis B outreach and education has been conducted at the beginning of the pandemic. Well, I'm going to now turn it over to Danite from New York to share some of her work with African communities.
Hi, everyone. I'm just going to quickly share my screen. Okay. So thank you again for attending this webinar and for having me as a panelist. My name is Danite Yamane, and I'm the Hepatitis B Project Coordinator at African Services Committee. So today I'll be talking about our work with HBV screening throughout this pandemic and what our goals are moving forward. So I have a brief outline as well about the presentation. First, I'm going to talk about just what ASC does in general and our mission, and then give you a little bit of background about our HBV program and our objectives. Then I'm going to go into what our work was like prior to COVID-19, as well as what our work has been like now throughout the pandemic. And I'll talk also about what our plans are moving forward. So to give you a little bit of context about ASC, we're a nonprofit organization that's dedicated to improving the health of African communities in New York. We provide a wide range of services that include, health, housing, legal, educational, and social services. So I work in our public health department, primarily on our HBV program with getting African immigrants screened for hepatitis B, and through outreach and education. So to give you a little bit of information about our HBV program, so viral hepatitis is endemic to about 8 to 20% of the African continent. And because of this, it's very important that we want to teach our community members about the importance of getting tested and screened for hepatitis B. Members of the African community are often unaware of their viral hepatitis status, and they lack insurance, as well as, suffer from other issues just immigrating to the United States, like language barriers and cultural differences, trying to navigate the health system in the US. So our goal here is to really breach that barrier and to try to help African immigrant communities receive the same access to care for hepatitis B, but also a range of other health diseases that we screen for, like HIV, tuberculosis, gonorrhea, chlamydia. Like we pretty much test for all types of other sexually transmitted diseases, and really want to teach people about the importance of getting screened early so that they know their status, and then link them to care. So our goal, again, is to close this gap in access to treatment and education, and primarily with hepatitis B, to reduce liver cancer deaths among African immigrants that are due to viral hepatitis. So our program prior to COVID-19 was pretty robust. We used to host several community awareness and screening events across all 5 boroughs in New York City. And at these events, we got to speak one-on-one with African immigrants about, again, just the importance of getting tested for hepatitis B, teach them about what the disease is, how it's spread, how to protect yourself and your loved ones. And then also afterwards, actually test them on the spot at these events, and then, follow up and link them to care depending on what their results were. We provided a lot of outreach as well. So we would, promote our services on radio ads, where we know that there's a huge population of African immigrants who are tuning in, on our social media platforms, on various promotional materials. We would go out literally into the streets to different neighborhoods where we know that are, densely populated with African immigrant communities, and try to teach them about our work and get them to come to our offices here in Harlem. So through all of this, our staff was able to provide really culturally competent education on viral hepatitis, because most of our staff are African immigrants themselves. So they have, a certain level of trust that's already established within the community by being able to speak the languages of most of the African immigrants that we serve, as well as, again, just being members of the community themselves. A lot of our staff members immigrated here from various African countries, and because of that, really can relate on a more personal level with our clients. And I think that really has made our program very successful in the sense that we're able to not only recruit new community members into joining, but also getting their contacts and people that they may know who, are apprehensive about wanting to get tested. So again, prior to COVID-19, we hosted 16 total community events across all 5 boroughs of New York City. And in that time, we had 130 hepatitis B and C tests that were conducted. And all of our positive clients, after we did these screenings, were linked to care. Our susceptible clients, so those who tested negative for hepatitis B, were offered the Heplisav 2-dose vaccine, or they opted to use their own provider for vaccination. And then our clients who are immune, either due to natural infection or from previously receiving the vaccine, were also notified of their results. So we also take a lot of time to follow up with all clients to provide, culturally competent education and counseling after we receive the results, and to encourage also all of our clients to refer any contacts that they may have who also don't know about their status to come in and get tested for free. So during COVID-19, like everyone has already mentioned, we definitely struggled trying to transition to doing our work virtually. We're, an in-person agency, so we're kind of like a one-stop shop where people come in and can receive various services, again, ranging from health to legal to social services, housing, case management. And so without having people, coming into our office every day, and then also having to shut down our office officially because of the start of COVID, it was really hard to kind of get in touch with a lot of our community members. Another reason for that is, there just isn't as much access when it comes to, digital like technology in general. So calling people was kind of hard. We'd call and some people don't have their own phones or are using phones of family members or, even in terms of trying to kind of modify our programs and doing them more online, like the rest of the world was starting to do with, implementing Zoom and things like this that we're on right now. That wasn't really something that was easily accessible for the African immigrants that we serve. A lot of people, don't have consistent access to computers with Wi-Fi and weren't really receptive to the way that we were trying to change how our work was being administered to accommodate the pandemic. So during that time, we spent a lot of time trying to follow up with clients over the phone about what their health status was and referring them to other relevant facilities for treatment or for resources. We also just, checked in a lot about the mental health of our clients during the pandemic, just to see how everyone was doing due to COVID, and tried to remind them again that like once things do start to ease back into normalcy and open up, to encourage them to get any contacts or people that they know in their household to come back to our office when they reopen to get tested. But again, most of our programming really was just done over the phone, where we provided a lot of health education. So we reopened on July 6, 2020, and we had several precautions in place to, make the office a safe space, not only for our clients, but also for the employees and staff. So we encouraged all clients to make appointments for their services, just so that we could predict the flow of people that were entering the office. We required everyone to wear masks and limited the staff from each department that was present. We have PPE everywhere in place, so plexiglass, hand sanitizer, mask, gloves. And we also required people to get temperature checks at the front desk and, notify us also if they knew what their COVID-19 status was. Like if you are positive or if you haven't been tested, we'd really encourage people to just stay home unless it was an emergency and they needed to come in to get some services. So since reopening, we have started to have more offsite testing events again, but it's definitely a lot, smaller in size. We haven't been able to be as consistent because the pandemic has been changing, right? There's been more and more variants that have been introduced. So while we have resumed our offsite testing events, we are still prioritizing, the health of our clients and our staff, and we're trying to make sure that the testing events are reflective of that. So we only have them outdoors now. Before we used to be able to have them inside, in various like places of worship, so local mosques and churches and community health fairs. But now we really only do them outside. We also try to, implement all the social distancing measures. So making sure that people are 6 feet apart. And again, like trying not to have any kind of crowds of people who are at our stands to get tested. So we've continued to have these events mainly now in Harlem, Brooklyn, and the Bronx. We haven't had any events in Queens or in Staten Island since reopening. But we are planning to try to host more events across all 5 boroughs. So during COVID-19, another change that we implemented was trying to incorporate quarterly webinars on hepatitis B, mainly because, again, since everything became digital, we wanted to also make sure that we had opportunities for our clients to still receive the same hepatitis B education and potential for screenings, if they could from home. And so we started hosting quarterly webinars where we talk about just the basics of hepatitis B, how the disease is transmitted, what the risks are, what you should be aware of, how to get tested, what your test results mean, and the interpretation of them, and things like that. So the webinars were actually really, really popular, more so in person. So once we opened up the offices again, we started to not only have the webinars on Zoom, but also in person for clients that preferred coming to just speak with us here in the office. And they were really great. So during the webinars, clients, they're more informal. Clients can, pause us at any point to ask their questions. They can bring, members of their community or their household who they think might be interested in joining. And, after the webinars, we also had incentives. So we'd give our clients, free Metro cards for coming to the office, as well as gift cards after completing some of our pre and post surveys and giving us feedback on how the webinars went and what they learned. And while they were here doing those webinars, afterwards, they had the opportunity to get tested on the spot. And we also provided COVID-19 testing. So, to accommodate people who, understandably so now, like everyone is talking about COVID, when they would come in, that we just noticed that was a big thing that people wanted immediately when they would come to our office now, was asking if we had COVID tests. And so we started doing that. We have COVID-19 testing for rapid and PCR tests. And so when clients come in to do those tests, we also would encourage them, if they hadn't already, to do an HPV screening as well, since they were already on site. And while we don't offer the COVID-19 vaccine, we have been, since the vaccine rollout started in New York City, we have been also incorporating vaccine education for all of our clients. So encouraging them to get vaccinated against COVID and, teaching them about the places that they can go in the city to get their vaccine. And, for our clients who got tested for HPV and then their results ended up being negative, we also provide that same type of vaccine counseling about the importance of getting the HPV vaccine to protect them against the disease. So moving forward, we are going to continue having our HPV screening events, as well as our services here in the office with COVID-19 precautions in place. But especially now that it's winter, it's going to be a little more difficult with trying to have, offsite testing events outside in the cold. But we are still following up with our clients regarding their hepatitis B status, just to encourage them to come in, to ask any questions that they have about vaccinations, linkage to care, and continuing to provide any contacts that they have for additional testing. Our quarterly webinars are going to start back up again as well in January. And again, we are planning to host more screening events at various locations across all 5 boroughs of New York City to make sure that we're really, reaching our target population, not just here in Harlem or Manhattan and Brooklyn, but all over. So I just wanted to say a quick thank you also to our partners that have been helping us with this work. Charles B. Wang Community Health Center has been really instrumental in supporting us with the same type of hepatitis B outreach and screening throughout the pandemic. So wanted to say a big thank you to them, as well as the Coalition Against Hepatitis B for People of African Origin, CHIPO NYC. And I also want to say a thank you to our collaborators, our local collaborators within the community who have offered, their community centers or their churches or their mosques as places for us to host these testing events. They've been super supportive again and great people to work with, and Hep B United and Hep B Foundation for their support also and for having me on this panel. So I will turn it over to Kate. Thank you.
Thanks so much, Danite. So it was really interesting to hear how all 3 community organizations have addressed hepatitis B during COVID and your different models from outreach to changing your infrastructure to having like on-site direct services. So I wanted to chat more about that as well. First, just to remind the audience, if you have any questions, please continue to send them in the chat box or use the Q&A function, as Evangeline mentioned. And I can start off with a few questions. So I wanted to talk a little bit about, Danite, you had just mentioned, everyone's talking about COVID right now. Everyone's much more aware. We as public health people in this work in the space have always been aware of vaccine hesitancy issues, right? But now we're hearing so much more about it everywhere. And I was wondering, as you have been working over the past year or so, what have you seen in terms of vaccine hesitancy, either amongst the communities that you serve, the different populations that you're serving, or if you are observing any age or generational differences when it comes to vaccine hesitancy?
Yeah, that's a great question. I think that for me personally, I have seen a lot of vaccine hesitancy within our population. So mainly because of, I think, a lack of, scientific information that's being spread throughout the community. So whether that could be through, WhatsApp or YouTube, I think that people are getting their sources of information about COVID through places that might not be the most reputable sources. And so that causes a lot of fear or concern. So, oftentimes when we are talking to people about the importance of getting vaccinated, we try to use like the CDC or WHO or use like reputable sources to kind of explain to them the importance of why they need to get vaccinated. But people will use some of these other sources as like their reasons behind why they think, it's something they wouldn't be interested in doing. So we do provide a lot of counseling for everyone, regardless of their status, just about the importance of getting the COVID vaccine. But specifically with HPV, for our clients that end up testing negative, we also have another like counseling session with them about how a vaccine would be needed for, hepatitis B as well. And because they're negative, this is the best way that they can protect themselves. So sometimes I have seen that, I think among younger people, as you alluded, like I have seen that younger people seem to be a little more likely to get the vaccine, whereas older people, again, maybe that could be due to just a lack of access to the right information. Older people do seem a little more hesitant or, not as confident about wanting to take these vaccines. So that's been something that I have seen as like an ongoing challenge, but I think that just, with more education and like more opportunities for people to come in and ask questions, it is something that can be, addressed. But I think also like establishing community trust is very important for that as well. So it's good that at our agency, like we have a lot of people who speak the local languages of most of our clients who aren't, primarily English speakers. So we can really explain like what we mean and what we're talking about from a place that I think people feel more comfortable and confident to ask questions. So that I think really contributes to trying to improve the pretty high rates of vaccine hesitancy.
Thank you. Catherine or Amy, did you want to add anything?
Sure. Yeah. One of we hosted a couple of vaccination clinics for coronavirus. And during the one thing that was really helpful was we had quite a few volunteers that literally just went down. So we were hosting at a local church. So we were in a community. And so we would literally have volunteers walk down the streets with flyers and really just talking to people and telling them about it. I think a lot of people just hadn't heard that the event was happening, or they didn't know where to access the vaccine. And so a lot of times it was addressing some of the lack of information and connecting people to the right resources that was needed, especially at like the local level. And just like walking down the streets was really effective. So super grassroots within Philadelphia was really important. But we have seen quite a bit of vaccine hesitancy as well. And I think, I think that's due to a variety of reasons, but just starting a conversation with like, why do you think that? Like, kind of, and just asking questions and having like a genuine conversation with people and trying to say, well, have you thought about this? And maybe try to see if you convince them. Sometimes you can and sometimes you can. And I think either way, you did your best.
Yeah, I would echo with what Danite and Catherine had just shared. And as a best practice, something else that HBIDC staff has done successfully is go to grocery stores and see people who aren't wearing masks and start asking them, would you like a mask? And that gives the opportunity for us to give out our PPE and information and start having that conversation. And it really is about just having that conversation and trying to understand where the misunderstanding is about COVID-19 and the vaccination. and just trying to debunk some of those inaccurate information. And we always remind all of our outreach workers that at the end of the day, people are entitled to what they believe. We don't want to get into an argument or a fight. We don't want to push too much, but we do want to offer information and resources in case they never had that opportunity to access it.
Thank you. Those are really important points. So, we've been talking about leveraging COVID, and you all have done either offsite or in ASC's case, on-site at times, been as part of COVID vaccine clinics. And Amy, I think you had mentioned to me before that HBIDC has offered hepatitis B education while people were in their 15-minute post-COVID vaccine wait time. And Catherine, I think you have a similar experience. And then Danai, you had mentioned that you had offered COVID testing. You offer COVID testing on site, and then you encourage them or offer them Hep B testing. So I'm just wondering about kind of the receptiveness of individuals to take up the hepatitis B education when they're at a COVID event, or when you've offered COVID testing. Did they get tested for Hep B while they were there, or did they say, "I'll be back"? Can you share more about that?
Yeah, so let me start. For HBIDC, we require pre-registration for screening activities or events. So if we're collaborating with a community partner and we're going to be on site offering screening that weekend, we let them know ahead of time what it is that we're offering. And then at the same time, if we're doing the blood draw, we will talk about the COVID vaccination opportunity and help them schedule a time to get vaccinated if it's not going to be offered at that event.
For African Services Committee, I definitely think that people have been pretty receptive. Usually when they're coming in to get tested for COVID, that's the only thing that's on their mind. So when we do bring up hepatitis B screening, a lot of the times the question is just like, what's that? Or what, why should I do that? So sometimes we do have people that say, okay, like, thank you for the information. We give them like promotional materials and things that really explain everything that we talk about in person for them to also take home. So some clients will say, okay, I think I'd like to read about this a little more on my own, and then maybe I'll come back and get tested. But we have definitely had, plenty of people who, because they're already on site, will say, sure, like, since I'm already here, if you think it's important, I'll do it. And that's been a good way, I think, to just kind of leverage the pandemic. Like, people are already coming in because they're scared about COVID. Well, we want to also make sure that they're getting tested for all the other things that could be, something beneficial for them.
Would echo what the other speakers have mentioned. And also, while we were doing vaccination, we had the 15-minute wait time after COVID vaccine. And that's a perfect opportunity to kind of engage people because you have a captive audience there for 15 minutes, which is a perfect amount of time to just really, pass out a flyer while they're sitting there or just talk to them briefly about it. So that was kind of what we did. And then, maybe down the line when we actually do have more in-person events, we're hoping to kind of, if we provide Hep B vaccine, offer COVID vaccine as well, since those can be administered at the same time, and potentially consider hepatitis A too. So really like combining all of these opportunities into one package thing for the community, all things that are needed for sure.
Well, thank you all so much for sharing that. I think that's really helpful information as folks, who haven't delved into COVID, but to definitely see the benefits of this ability to reach people with hepatitis B or hepatitis C information. So we are at the top of the hour. I just wanted to thank you all, Amy, Catherine, and Danai, for being with us, taking the time to share your experiences with us. Thank you for all of your work to address hepatitis B in your communities. And thank you everyone for joining. I'm just going to drop our email address here, not drop, but share my screen so that you can see. Feel free to email us if you have any follow-up questions. And also, as you leave today, please do take the time to share your feedback with us in a post-webinar follow-up survey. And we hope to see you on the next one. Thanks all. Have a great day. Bye-bye.